Hi, everyone, and welcome back to another episode of the Bulletproof Hygiene podcast. We are so thankful and grateful to have you joining us today. Today, we're going to talk about introducing new ideas, products, and services, and how sometimes daunting it can feel to do that, especially with our existing patients. So it can even feel impossible in addition to just feeling daunting, especially if we're out of practice or we haven't tried to onboard or implement something new in a while. So there are so many reasons why this is one of the topics we discuss most frequently with people we connect with and coach. So I think first off, some of our fears surrounding this topic are, the questions, the self-questioning and the self-doubt, like, will the patient believe me when I'm explaining, an issue and why they need this new product, service, or thing? What if they're mad that I never brought this up before? What if I don't deliver the information perfectly, or I stutter, or I don't know all the answers to their questions? What if I'm slow on the uptake? What if they say no? And what does this mean about me as a clinician? So I mean that in the case of like you're transitioning from a bloody prophy atmosphere to trying to treat active perio type of thing. So I think sometimes too, there's shame, or we can feel guilty because we maybe haven't been doing all the things we know we should or could have been doing. And we feel like acknowledging that fact will maybe be a crummy or difficult task. But what I think is important to keep in mind is it would be a lot more crummy to stay in denial of maybe, the things that we haven't been doing ideally or up to the standard of care for our patients. And, if we chose never to move into a better place as a provider by practicing to the full extent of our licensure, and finally, starting to offer our patients our absolute best. So I think that just staying in that place of stuck guilt or shame or whatever it has been, there are reasons and limitations for the reasons why maybe we haven't been practicing to that standard. Maybe it's been time, maybe it's been overwhelm, maybe it's been lack of support from our dentist or our team. There's a lot of reasons why, right? It's just important that we kind of troubleshoot and look at those reasons and work through them instead of just staying in that same stuck place. So it can be painful and uncomfortable to acknowledge that we can all do better, but also exciting to know that we can offer more and do better. So in other situations, we might learn something new and then want to implement it, but are afraid of pushback or rejection from our longstanding patients. And we might be afraid of discomfort or not doing things perfectly, like I just mentioned. But we're all imperfect and all need to give each other a little wiggle room to learn, to grow, and be messy while bringing our best to the table. And every single day that we practice these new things, our best will become better, right? So this episode is called Teaching Old Dogs New Tricks. And in this scenario, both we, the clinicians, and our existing patients are the old dogs. And the product or service we're trying to implement is our new trick.
Yeah, and I do think this is one of the most common questions we get from the hygienists that we interact with is, hey, I'm excited about this. This makes sense to me. I believe in this, but I don't really know how to talk to my patient about it. Or, I haven't been doing this up till now. Like, how do I do like an about face and talk to them about this? It does feel a little scary and uncertain. And you want to make sure that you're coming across confidently to your patient and that, this is a trustworthy conversation. So I'm glad we're talking about this today because I think this is on a lot of people's minds.
Mm-hmm. Yeah, and I think that there's a balance. We have to become, and to some extent, competent in what we're about to offer our patient before we start offering it. But then there is that point where you just have to jump in and start using it. So become as competent, learn as much as you can, practice as much as you can, but don't let trying to be perfect at something new keep you from actually implementing it, because that's what I see so many times, even in hygienists on my team. Like, their fear of not being able to do something perfectly will keep them from ever starting. And then that's the real issue. None of us is perfect. We all make mistakes. We're all in this process of learning, but getting in our own way by insisting on perfection before we start doing something is really, I think, the biggest hurdle that we've all got to get through or get over.
Yeah, agreed.
So a commonly asked question specifically is, how do I start offering my patients preventive services if I've been seeing them for years and never have offered these things before? So some examples of what we might offer is like fluoride or adult sealants if these things aren't in our typical line of practice. So there are a few ways to do this. And one of the easiest ways, I think, and I've experienced, is addressing these preventive things with a patient who just underwent some restorative or surgical treatment. Okay, and the verbiage that I often use is, Mrs. Smith, up until now, we've been focused on putting the fires out. We had to control your decay and perio disease. And now those things are very much arrested and under control. So we can get a little more particular and switch into prevention mode proactively. When I'm evaluating your teeth, one thing I'm noticing is that you have these deep grooves on the biting surfaces of your back teeth. And on several of these teeth, you've had cavities before. So these areas are at higher risk for developing decay. It's always better to preserve your natural tooth structure by preventing cavities than having to remove some of your tooth structure and replace it with synthetic material. I'd really like to put clear sealant material on these teeth, and then I show the patient, the photograph, or use a mirror to show them specifically which teeth I'm referring to, which teeth have the deep grooves and which teeth, similarly, like if a first molar has restorative, it has an occlusal filling, and then another first molar has a deep groove, I show them this is specifically what I'm referring to. And that is the best tool. Obviously, a picture is worth 1,000 words, and you don't really have to explain very much. It's okay to, in this situation, acknowledge like, hey, we're switching things up, but we're totally switching modes. We've just put all the fires out, and now I want to switch modes to prevention. So we've kind of set the patient up to be ready to hear this information, and then we show them what's going on. So then you say, this makes it real and personal for them. When we personalize it and say, this is your tooth that I'm considering sealing, not like a one size fits all solution. And you're designing a small treatment plan to fit their exclusive needs, I think it brings them to a place of yes and understanding a little more quickly. I think they're more willing to hear what you have to say when we personalize a treatment plan like that. So you can also explain, this is usually not covered by insurance for adults. They usually dictate a specific age cutoff, which has nothing to do with your actual risk for decay. If they're not covering this for you, I'll honor their rate, which is typically in the $20 to $30 range per tooth versus the usual customary and reasonable fee, which is about $80 per tooth. So I let them know that even though their insurance is dictating that they will not cover this procedure, I will still honor their insurance rate, their in-network insurance rate. So they're paying that cash out of their pocket, but it's still a lower fee than if they had no insurance benefits at all.
Right. And I know for us, we are fee for service. Now we do, for hygiene, we will take estimation and then have the insurance pay the office directly the remainder. But for most of our patients, like sealants aren't covered for adults. So there is no room for that for us. So we do a straight fee of it's $63 for sealant. But a lot of times I'll go ahead and talk about doing maybe the tooth next to it or, one up from that. And just kind of say, hey, I'll do 2 for 1 for you just as an added benefit since I'm already in here in this area. So that's a nice thing we can do as well. And it, doesn't take any extra time.
Yeah, it creates value and essentially no extra time. How long does it take for you to put etch on the second premolar versus, just the first molar? Yeah, so if the patient says yes, then they can be scheduled or completed the same day, depending on the time allowance. And if they say no, I just say, okay, no problem. This is a completely optional preventive service. I'm okay with waiting to see how this changes as long as you're fully informed of your options. And then I just add it to my clinical note. I leave the treatment plan in there essentially. And I just put in my clinical note, discuss recommended sealants on teeth numbers 2, 3, and 14 or whatever, and then I might, if I'll circle back if the patient was like, oh, let me consider it, let me look into insurance and let me see if they will cover what the fee would be. And if not, then I don't circle back. If it was a hard no and they're like, no, I don't want to be proactive or preventive, I want to be reactive and just fix things when they break, perfectly fine. Now they're informed and my treatment plan is in there. So for fluoride varnish, for instance, you can say we recently started offering topical fluoride varnish to reduce decay risk. And we were finding that for patients with exposed roots or history of recent decay, it helps to reduce their risk for sensitivity and future decay significantly by applying this every 3 to 6 months. So you're letting the patient know we recently started offering this beneficial procedure if it isn't something that you've been implementing regularly prior to this. And that is absolutely true, right? You don't have to make up some elaborate like white lie or something, to make your patients think like, to overcompensate for whatever you have not been implementing. It's okay to say, we just brought this on board. We just started implementing fluoride. This is why I'm recommending it. This is what the research says, because you're being transparent and real and you're giving the patient the option. So I always like to, especially in regards to fluoride varnish, personalize it. So if the person recently had restorative due to decay or has exposed roots, dry mouth, etc., I explain that that's my concern and that's why I want to do it for them. So it's kind of like the sealant situation. specifying which teeth, need the sealant, specifying why this particular person could benefit from fluoride varnish. I then explain, it takes about 30 seconds for me to paint the clear gel on your teeth. Are you okay with me doing this for you today? And nowhere in there did I discuss cost yet. And that is a necessary conversation to have before I complete this procedure for them. I never want, a person to be sticker shocked or surprised with a bill at the end. That's not a good feeling. But I go through all the benefits, ask them if they're okay with me doing this procedure, if they understand the benefit, if they have any questions, and then I inform them of the cost. Okay. So if they're like, yeah, that's fine, then I say, typically this isn't covered by insurance for adults, which has nothing to do with your actual decay risk. And if fluoride is not covered, the average fee is about $30. Are you okay with that? Because cost should always be presented last, and that's not for the sake of being tricky or trying to, scheme with it has nothing to do with that. It has to do with when a person hears the cost for something that they don't already value, they stop listening at the cost, right? So if you do it in reverse, where you explain a new concept to a patient, you explain the value and how this can benefit them, and then the cost, and they listen to the whole thing and decide if the cost is worth it or not. And at that point, they still have a choice, right? So you're not cornering the patient into anything. You just want them to hear the value before the cost so that they understand the value. They get to hear the entire thing.
Right. And I think this is a really important way to present this versus, because I've heard this happen before, where at the end of the appointment, the hygienist just kind of flippantly says, hey, did you want to do fluoride today? Instead of, hey, Mr. Jones, I'm really concerned because you have, some generalized recession. I know you've had history of, having fillings done. There was a moderate amount of plaque present today. I think it would be really beneficial if we went ahead, now that I've gotten everything really cleaned up and exposed, for us to go ahead and do a fluoride treatment and just remineralize any of those weakened areas and just, come from a preventative aspect. I think that's a whole lot different than just saying, hey, did you want fluoride today?
Yeah.
So I think just kind of shifting the verbiage that we're using and the mindset that we have, and remember honestly that our goal as hygienists really should be preventative. It shouldn't be reactive to infection and decay. It should be, on the flip side of things. I feel like for so much, honestly, for the beginning of my career, I was very reactive because I wasn't sure how to talk about these things and I didn't have a whole lot of confidence in myself. Now I understand that if we can truly be preventative, we're going to avoid a lot of issues and a lot of finances and a lot of, time and tooth destruction and all of that. So I think it's shifting your mindset and really understanding and helping our patients understand, like, we are here for you to prevent issues. So let's do that together. And these are the ways we have to do that.
Right. And I'm sure that your patients, when you explain it from that place, can sense that, like a lot of people are afraid of being perceived as selling something. Right. If you're trying to relay something that you truly believe and you truly value and will benefit the patient, it's going to come across differently than if it's something that you don't believe in and don't value, and everyone on the receiving end, they have a choice too, based on their biases and prior experiences and all the things they're going to, formulate their own conclusions based on all of that as well. So sometimes someone might perceive us as selling, even if our come from is truly like, I want to do what's best for you. I want to prevent issues. This is going to equal less cost for you long-term because you're putting up a small amount of money right now, kind of thing. Right. And there's always they always have the option to not believe us or not say yes or whatever, but at least they have the option, at least give them an option. If they don't know what they're missing, they don't have an option, and that's not really fair. That's not enabling our patients to make autonomous and educated decisions about their own health,
Right. And we have to remember, patients, we say this a lot, patients come to us for our professional opinions on things, and they don't know the latest and the newest and what, what the research is saying. So it's our job to help educate them on that. It's our job to be aware of it, and stay current, and then to turn around and make it easily understandable for them from an education aspect so that they can make those best decisions. Because if we're not telling them about it, if, we're not vocalizing that, then honestly, we're making the decision for them.
Yeah. So a few more things that we can talk about on this topic are the topics of, desensitizers and comfort services. So a lot of times the way I start this discussion would be, if I haven't offered this before, something like, Mrs. Smith, I remember last time you were here, you mentioned that your teeth were sensitive to the Cavitron and to cold water. We're now using a desensitizer that has made this procedure a lot more comfortable for a lot of my patients who have had this experience. And then, I'll tell them what it's called. It's called Tums Rapid Relief or Core Desensitizer or Nupro Pre-Polish, whatever your preference is. And then this is something, because it's typically a very low cost to the office, I often offer it the first time at no charge. So I'll say, usually there's a fee of $26 for this, but I want to do it cheap for you today. Excuse me. At no charge, just to see how it works for you. You can let me know if it's what you prefer for future visits. So the patient is now happy because you got in front of their discomfort. That's the first thing. You're giving them something for free, and you've informed them that they're not your guinea pig. So you've used this on other patients. There's a lot of research behind it. It's successful. It's been great. Other patients have reported they're a lot more comfortable during this procedure. You've tried this on other patients and it really clearly works. So depending on your office's policies and flexibility, sometimes this is even possible for things like nitrous. And that's something that in my office I really value, is having a lot of autonomy to courtesy procedures kind of at my discretion. And of course, if I'm courtesying something, I'm paid based on a percentage of my collections essentially. So it impacts me, right? So it impacts what I take home. It impacts what the office earns. So that's a consideration. So we never want to overtly just start giving things away, because we also want to value what we do and it is worth the money. I think if it's someone who is cost sensitive or cost conscious, I might offer nitrous at no charge the first time, for the sake of hey, these are the comfort services that are available to you. Is the value worth it? You can decide and let me know at the next visit. And then this is the fee if that's the case.
Yeah, I think that's awesome. I think that's really, that's a great way for them to experience it. And like you said, see if that works well for them. Mm-hmm. And oh my gosh, isn't every patient wanting to be really comfortable? I mean, we have so many patients telling us all the time, I hate coming to the dentist. It's, it's my least favorite thing. But if we can make it comfortable and make it, even more than tolerable, if we can make it comfortable, then they're going to be return visits. They're going to share about who we are and what we're doing with their friends and family, which brings more patients in. And everyone likes to get a little something for free. So that's a really cool way to kind of introduce it the first time and say, hey, let's just try this and see if this works. And then going forward, then, you have that option to do that.
Right. And when I think, it's so funny because when I think of the desensitizers, I think of, okay, this will make the patient comfortable and this will make their experience comfortable. When I think of nitrous, I think this will make their experience enjoyable.
Right.
They want to come back for the nitrous. And so many people say that. They're like, oh, it's such a nice break from my work day. Right. Or something, right before the weekend. They're like, let me come in on a Friday so I can get relaxed. And they plan their dental appointment around the nitrous. It's funny.
That's awesome.
In regards to something like whitening, that's clearly just an aesthetic concern. It's a complaint that a lot of patients come in with, right? A lot of times it's their chief complaint before they find out that they have dental or periodontal issues, right? So if I, let's say as an example, saw a new patient whose chief complaint was whitening, and then we discovered that they had some existing decay and active perio disease, clearly whitening is not going to be on the top of the treatment plan. It might be on the bottom of the treatment plan, right? So if we are continuing care after they have eradicated some of the active disease processes in their mouth, I would ask, how does everything feel in your mouth since I saw you last time? I'm looking back at your prior medical history and I can see that you wanted to whiten your teeth. And in our medical history, there is, a section for chief concern, chief complaint, what you would like to accomplish in this visit. And so that's where they would have disclosed that. And then I would say, I know we recently took care of some fillings and treated your gum disease. Now that the most important health concerns are under control, I want to make sure that we circle back and address some of your initial concerns. Would you like to hear about whitening options? So that lets the patient know you're not just again, blanket statement trying to sell them whitening. You're saying, hey, you brought this up on the first visit. I just want to circle back and make sure that we've addressed that with you. If not, would you like to hear about what your options are? Giving the patient the freedom to say yes or no. So this is very straightforward. And if they do say no, they're no longer interested, which almost never happens. I say, no problem. Whitening is completely aesthetic in nature. It doesn't improve or harm your oral health status. So I won't bug you about it again. Feel free to bring it up if it ever becomes a priority for you in the future.
Nice.
So Perio Protect was something, one of these things in our office where, scanning with the iTero was one thing, then learning how to discuss it with our patients and treatment plan it, submit the script and hope it worked, because I think that for all of us psychologically, we believe in research clinically. You know what I mean? Like clearly that's a huge part of hygiene, anything in medicine. We look for valid and reliable research proven over time, right? But I think that there is a certain amount of psychology that goes into trying out a new product, even understanding the research and the recommendations and the outcomes, and still wanting to see anecdotal evidence, or at least that's what I've seen from my team. Is like they read the research and they were still a little hesitant to start implementing Perio Protect because they wanted to see it firsthand.
Yep.
So I think that there's a little bit of that for all of us. So that was another barrier. And it was, I think, a tough pill to swallow for some of them on the front end. But now I would say it's one of our favorite products. And I think that we had a lot of discussions around what are our barriers, what's keeping us from offering this to our patient, and like many other things, a lot of it was our own perceptions and fears about the cost, and assigning who can and can't afford this procedure, or, our own capability to explain the procedure in depth, our own capability to follow through on whatever was needed from scanning to submitting the script and all the things. There's a lot of challenges when it comes to starting to implement a new procedure. So it just makes total sense to me. And these are the things that I've seen like over and over again, and some of the things that have worked best for me.
Yeah.
Charissa, do you want to cover some of the Perio services?
Well, yeah, I think Perio is the biggest part of all of this. This is the question that I think we get more of this question of like, how do I talk to my patient about this? Because this is like one of those uncomfortable moments, but let's be honest, like the reality of some of our listeners kind of being in that bloody prophy mill type situation, that there's probably a pretty high chance that some of our listeners have been stuck in that. I know I was stuck in that and I didn't even know or realize it. And so when you come to that realization and you're like, wow, this is really a disservice to our patients. This is a disservice to our practice and honestly, our licensure. We know that bleeding gums are indicative of inflammation and infection, and they really do necessitate periodontal therapy. So, the question is, how do we get off the bloody prophy train and really help educate our patients when we haven't addressed it in the past? And, if your MO has been doing like a bloody prophy and telling your patients, yeah, bleeding isn't really healthy, it's not really normal. We don't want to see that. So let's get you to be flossing more, let's brush a little more. And we'll just see how things look next time. And then there's like, that's your MO over and over and over. Then all of a sudden, like there's that fear, like, wait, what if today I tell them this is actually infection and it's not okay? Like, how do I tell them that when I've just been telling them, yeah, brush and floss more, but I've never really done anything about it. So this is where I think this conversation really comes into play. And I think you have to first kind of take a look in the mirror as a provider and ask yourself, who do I want to be? How do I want to practice? And how do I want to care for my patients? And if you arrive at the place that you're not going to compromise their health, and you're going to do the right thing for them because it's the right thing to do, and you really come from that personal conviction, that patient's going to be able to read that in you. I think it all starts with getting the patient more involved in the assessment stage, right? So if you are perio charting, it's really important that you explain to them what you're doing and what that assessment means, and then involve them in it, meaning do it out loud. And I know people say it and think all the time, like, Charissa, this is easy for you because you have an assistant. So she's right there to record those numbers for you. So honestly, the reality is most of the time my assistant is in the other room finishing up an exam with a doctor. So we do not, I know Brittany's practice uses Florida Probe, and we just feel like that's not a great fit for our particular software. I tried another couple of options and those didn't really fit either. And what I've been doing lately, and it actually works beautifully, is I have an iPhone and I just use my voice memos and will record those numbers. And then later in the day, my assistant will go ahead and transcribe them in, or myself at the end of the day, into the computer. But it gives me the freedom to explain to the patient, hey, I'm going to do an assessment of the health of your gum and bone. You're going to hear me calling out some numbers. Anything from 1 to 3 is normal and healthy. Anything 4, 5, or above, or any areas of bleeding indicates some inflammation and infection. Let me roll back for just 2 seconds and say this too. When I bring a patient back and seat them, obviously I'm asking, hey, have you had any new medications, new allergies, new doctor's findings or surgeries? And anything dentally that you noticed or been concerned about. And then I also ask, what's your current home care been? How many times a day are you brushing? Are you flossing? Are you feeling any tenderness or seeing bleeding? And I get that answer before I've even looked in their mouth. Because honestly, in my head, I'm kind of building a case for whatever needs to happen today. So if they're like, yeah, I'm brushing twice a day, I'm flossing, twice a day, I'm not seeing any bleeding, everything feels great. And then I get in there and do the assessment and everything looks perfect. Awesome. We're in agreement. Everything looks good. But if I've got a patient who's like, yeah, life's been crazy. Honestly, I'm flossing maybe twice a week. Yeah, I probably do see a little bit of bleeding here and there. I know that already. And then when I do my assessment, and they're hearing me calling out 4s and 5s or bleeding, by the time I'm done with that, I can say, hey, look, obviously those numbers aren't healthy numbers. You're also telling me that your flossing, hasn't been consistent and that you're noticing bleeding. Honestly, we've got active infection going on in here and we need to do something about this. So I think first step of involving them in that assessment, making that co-discovery together is really important, because at that point, they can't really deny that there's stuff going on. I think there's a lot of terminology that we can use as we're having these conversations. So I think patients expect us as providers to be learning and growing, and both in knowledge and technology. So here's a few great transitions that I think we can use when we're having these conversations about something new or different. Just saying things like, hey, new research shows that this kind of bleeding and inflammation and infection that we're seeing today puts you at risk for greater systemic issues. Maybe it's saying, hey, I recently took a CE class and I learned a lot about gingivitis or periodontal disease or whatever that patient's got going on. You could say, I've been reading a lot of new research and I'm really concerned about this. This is not healthy. This is infection. This puts you at risk for more impactful systemic disease. I think it's just really shooting straight with them. And again, you've got to be comfortable with yourself as a provider to make sure that you are coming across confident and willing to answer their questions and know that it's a mutual conversation. And I think, a lot of hygienists struggle with this. So it's hard to switch from a bloody prophy to the non-surgical perio treatment. And if you work on a team of 2 or more hygienists, then I think it's important to, kind of have the conversation together, like, hey, how are you doing this? What seems to be working for you? Lean on each other. Make it a team strategy. Brittany, what are your thoughts?
Yeah, I think that if you're on a team of, 2 or more hygienists, one thought is, like you said, get on the same page, like make a standard of operations, like you have the if this, then that, trickle down, or it's what is it called? What do you call it? The treatment planning basics, like if there's 4 to 5 millimeters with bleeding.
Yeah, you create that office protocol. And that's,
right.
That's a really good point. And I want to say this too. Mm-hmm. If you are in a practice that's not been treating perio to the full extent, you probably need to have a conversation with your doctor too. Mm-hmm. Mm-hmm. Because it's funny, I noticed that I work with our hygienists at our practice in setting goals on a quarterly basis. Mm-hmm. And we've learned that it's really important to share those goals with the doctor, because I've had one of our doctors came to me and he said, what is going on with so-and-so hygienist? Like, she's recommending sealants for everybody. And I was like, oh, actually, that's one of her personal goals, is to be more, aware of sealants for adults and the benefits that they pose. And, so it's funny that you've got to really think that through for the whole team and share those goals for the whole team. But obviously, if your perio numbers are low and you haven't been treating it, appropriately, it needs to be a conversation with your doctor, obviously, because they're the ones that are, there to, diagnose and treatment plan what needs to be done. So if you find that your numbers are low, it's time to set up a meeting, with your hygiene team and your doctor to say, hey, like we're doing a lot of bloody prophies here, and this is a disservice to, the patients and to the practice and to the, the bottom line of what the practice should be producing and collecting and bringing in.
And the objective data that I think you can always bring to that conversation to help remove the emotional subjectivity from that conversation is just the data of the actual perio disease stats of our population and compare that to the treatment that you're actually providing to your patients. So if your perio percentage is 14%, but the needs of our population are, 50% or higher, like where's the discrepancy happening? And I think that just keeps it less personal, so people don't feel attacked or don't feel uncomfortable about the conversation. It's just objective data that you're bringing and saying, hey, we all need to do better. Like we all as a team need to rise up to this challenge kind of thing and fulfill the needs of our population. And another thing I wanted to bring up about working on a team of 2 or more hygienists is I think it's one thing for you to have been, maybe not practicing to the best of your ability, or maybe due to time constraints or whatever reason, doing bloody prophies. And now you're like, okay, I really need to take a step back and educate my patient about what's going on with their health. That can be a challenging conversation, but still definitely doable and implementable. I think one of the best things that you can do is if you're seeing a patient that you've never seen before, just start diagnostics from scratch. So I work on a team of 8 hygienists. Actually, it's about to be 9. We're bringing on some new team members. But anytime I'm seeing a patient who has seen someone else and has never seen me, I start from scratch in regards to the medical history and dental history and researching the notes, looking at the perio chart, looking at the prior radiographs, obviously updating radiographs if necessary, but I always do my own comprehensive perio chart. And it's not because of a lack of trust. It's because I want to tell the patient, like, hey, you're new to me. I want to pick up where we left off and move forward. And we're doing assessment. And it's an opportunity to explain, I'm a new provider. I want to understand you to the best that I can. And also I want to make sure that we're treating you adequately and appropriately according to where you are on the spectrum of health. Telling them, we'll do the perio chart, going through and re-educating them about all of that. And that is a really ideal time to make a transition, like a bloody prophy to a NSPT or a localized NSPT or a 1 quadrant here or whatever. Because it's like, okay, I'm a new provider. We're taking new diagnostics. We're evaluating from the bottom up. And this is a great time to check for any changes. Like basically face it like it's an opportunity, or almost like they're a new patient. I don't know. I find that conversation is a lot easier and more comfortable for people to have than the one of changing your own patient from a prophy to a localized therapy.
Right. Yeah. So you brought up Perio Protect earlier, and we talk a lot about Perio Protect because we both really believe in it, and we've seen some really great things with it. And I think if you're listening and you're like, yeah, I would kind of like to try that, but I just don't know how to start it, I would say your perio maintenance patients are where it's at.
Yeah,
I would start there. You will see the benefits, and then you'll get, more brave and courageous with it and start, kind of branching out. But I have conversations with my perio maintenance patients and we all have these patients that aren't truly maintaining health. We're seeing them every 3 or 4 months. We're still seeing some bleeding. We're still seeing some localized, spongy inflamed tissues, no matter what they're doing with their home care. And, it's one of those frustrating things for them, I know, because, they're taking their time and their money to get things, under control. But I like to be very honest with them. I think it builds a lot of trust when we're just really honest and transparent. So a lot of times I will have just a really direct conversation with those patients and say, hey, look, I got to be honest with you. What we're doing right now, the goal of what we're doing is to be maintaining health. But actually, that's not what we're doing. I'm still seeing bleeding at these visits. I'm still seeing inflammation and, spongy tissues that aren't healthy. So I don't want you to get discouraged because I know we've done a lot. But at this point, I feel like we've done everything we've known to do. It's time to think outside of the box. And what we know about periodontal disease, it is very multifactorial. There's a lot of things that we can't control as far as your particular host response goes. The only thing that we really can kind of control is the bacterial biofilm. And I have a way to do that with something called Perio Protect trays. And basically, it's going to help us maintain that oral microflora underneath the gums on a daily basis by using a low-grade peroxide gel to keep those anaerobes from setting up camp and becoming active far beyond what you can reach with your toothbrush and floss. So I have a lot of patients that have moved forward with these trays. They are really effective at kind of getting them off the roller coaster of needing deep cleanings every couple of years. And I've seen it work well. So at this point, I think that should be our next step. It's pretty conservative over doing some, like surgical procedures. And obviously, if you've got somebody who's just way off course and things just aren't responding, then it's probably time to send them to the periodontist. But if these are localized areas, I think Perio Protect is a great way to see if we can't get that under control. And then if not, obviously we're going to go the periodontist route. But I think that's a great way to start. And I think just being really honest and transparent, like, hey, I'm doing my best, you're doing your best. Unfortunately, there's some things we can't control here. Let's think outside of the box and do something different.
Yep, 100%. So I hope that this has been helpful in regards to becoming more comfortable and accepting that we're all having to constantly learn to implement new things. And with each new thing, the implementation is going to bring about different challenges and look different. And it's going to look different from office to office and provider to provider. I think the most important thing with all the things that we just covered is to make sure that we're being authentic, make sure that we understand what we are offering to our patients to the best of our ability, and understand, how to realistically discuss these things with our patients for us personally, like find out what verbiage works for us, find out which facts you want to relay ahead of time and have those kind of prepared, like Charissa has done and talked about so many times, maybe even practicing your verbiage in front of a mirror, practicing with some colleagues before you jump in. But at some point, don't forget, you don't need to be perfect to jump in and start using these things. So we hope that this has been helpful to everyone. And we hope that you guys will continue to, be willing to onboard new things and try new things and get curious. And that we're all constantly asking, like, how can we do this better for our patients? So we hope that this was a helpful episode. And we thank you so much for joining us. As always, we are so grateful for your presence here. If you want to connect with us on a deeper level, please feel free to go to our Mighty Network and search Bulletproof Hygiene, and we will see you there.
Everybody have a great week. See you next time.